I hope you are fine. I am also in good condition. Today we will discuss regarding the prevalence of tooth decay, which is more in the children, toddlers, kids. What is the reason behind why children are more prone to dental caries or tooth decay? First of all, we have to visit the anatomy of the teeth. There are basically three layers of tooth structure. First and outermost is enamel, second is dentine, and third, which is basically a soft tissue, is dental pulp. The outer two layers are in children very thin and porous and less mineralized, contain less amount of calcium and phosphate, and furthermore the dietary habits of the children are they depend more on sugary items, snacks, chocolates, toffees, cold drinks, which contain huge amount of sugar. And in our mouth, there are more than 300 different strains of bacteria. When the child eat a lot of sugar, the bacteria residing in our mouth utilizes this sugar as their nutrition and ultimate produce in a process of fermentation the acid attack on the tooth surfaces and extract or releases calcium and phosphate from the tooth structure. The ultimate fate of the tooth is decay or cavity, and the child suffers a lot in this whole process by sensitivity, food infection, and toothache. So, it's very important for the parents to care their children, to give them a good diet, avoid sticky foods, sugary items, and cold drinks, and always make their habit, make them some interest in toothbrushing, especially before going to bed and in the morning before the breakfast. Twice a day is recommended time for toothbrushing. One problem we face while advising a toothpaste for the children, as children are more prone to tooth decay or dental caries or cavities, so this reflect or shows that we need more amount of fluoride in their toothpaste, but the reality is different. If we recommend more than 1500 2000 ppm fluoride in the toothpaste, the child, when he brush his teeth with the toothpaste containing huge amount of fluoride, he can swallow the fluoride along with the toothpaste. And the fluoride, when ingested, it affects the whole body parts, especially the bones of the skeleton, and ultimately it results in brittle bone disease, brittleness of the bone, skeletal fluorosis, a term used for excessive fluoride affecting the skeleton. Also, sometimes increased ingested amount can cause fatal problems with the children. So, for the kids under 6 years of age, it is advisable to use fluoride free toothpaste or toothpaste containing xylitol, which is much better than fluoride. Xylitol has diversity in function. It inhibits the metabolism of bacteria producing the acids, and second, it remineralizes the tooth structure with calcium and phosphate, which is very important for strengthening of the tooth structure and fighting against the acid attack from the bacteria. So always care your children, their teeth, educate them, motivate them how to brush, when to brush, which toothpaste is suitable for them. Also tell them the adverse effects, the horrible effects of sugary diet, excess intake of sucrose or sugars, and repeated or frequently use of these items is very dangerous and ultimate results in rampant caries which affect the whole dentition within months. So it's basically acute caries which involves the whole teeth of a children or child within months, within a very short period of time. Another important thing which small kids usually use and then they suffer is bottle feeding. The mothers place cold drinks, juices, milk with sugar in the feeder bottle, and the child utilizes this whole night and ultimate results in excessive fluoride in the mouth. Bacteria enjoy this sugar and produce a lot of acids in the oral cavity, which results in tooth decay and a great misery for the children. And at this stage, it is very difficult to treat a patient with toothache. While treating a cavity of a child with toothache, usually we have to perform the procedure under general anesthesia, which has its own complications and is very traumatic to the child and the parents. So, in children, always stress on preventive measures. Take care of your child, take care of their toothbrushes, toothpaste, and all things belonging to them so that in the future their sound teeth or tooth will reflect your care. Hopefully, this video will be informative to you. If any question related to this video, you can ask in the comment box. Also, like and subscribe the channel so that further information will be provided to you. Thank you.